Well, I'm a GP. I've had about 38 years experience as a GP. I practice now mainly in the field of skin cancer medicine, but I do about 20% general practice. And I also have a position at the Queensland University as Associate Professor, and I'm in charge of the Master of Medicine Skin Cancer degree course. The Master of Medicine degree is a postgraduate medical degree, not based on research as would be a PhD or an MPhil, but based on coursework. And it gives doctors the opportunity to actually get a postgraduate degree. Now, most specialists in any field have a fellowship of a college, but they don't have a postgraduate university conferred degree. And this is a very important opportunity for doctors who practice skin cancer, whether they be primary care doctors or plastic surgeons or dermatologists or dermatopathologists. And it means that when they've got this degree, they've done the coursework, they've done the study, they've had the instruction, and they've been examined on that to a high level of expertise in skin cancer diagnosis and management. Firstly, there's a real degree of increased expertise as a skin cancer practitioner, right? Because of the learning that occurs. But secondly, there's also a perceived degree by peers and patients. In other words, the practitioner has a qualification. He has a qualification that is a university conferred qualification from one of the top universities in the world. And it's based on the strict guidelines that universities have to follow to give degrees. The other advantage I see is that at the moment there's no accreditation by which patients can judge whether a practitioner who practices skin cancer is an expert or just someone who calls himself an expert. And when we have a few thousand doctors out there with this degree, this university conferred degree, and especially if they've gone on to use that as a stepping stone to become fellows of the Skin Cancer College Australasia, patients will have a way of judging the expertise of their doctor, which they do not have at present. And that is something, as I see, a big advantage in the future, because skin cancer management is a matter of life and death for some people. It's a very important thing. It's a very important thing in the Australian context because skin cancer and melanoma are so common here. And that makes it even more important that it's managed ethically and appropriately and with a proper expertise. Now, there are not enough dermatologists in Australia to manage the skin cancers here. There are only 300 odd dermatologists in Australia. That's one for every 60,000 of the population. As a result of this, GPs or primary care doctors manage more than half the skin cancers and melanomas in Australia. And so, because there's really no training at the undergraduate level in this particular discipline, it is really important that a structured educational pathway be established by which doctors can not only have expertise but be seen to have expertise. Okay, the Master's program is delivered 100% online. There is no need for students to attend the University of Queensland campus. Okay? It is taught by experts in the field, some of who are primary care practitioners and some of who are dermatologists. And it covers the foundation that is needed on embryology, physiology, anatomy of skin cancer, dermatopathology, and the important modules in particular are on dermatoscopy and the management of skin cancer. So it covers all the things necessary to understand, diagnose and manage skin cancer, all delivered online. There are 16 units to the course from 7 different courses. It's delivered over 2 semesters, a year, and it can actually be completed in 1 year or more. Most people who do the Master of Medicine Skin Cancer degree do it over 2 years. And that's people who are working full-time in practice, so it doesn't disrupt your practice. Because you do it online at your own pace, you can work full-time while you're doing this degree. Dermatoscopy and dermatopathology are not taught to undergraduates, and there is no formal training apart from that delivered, as I understand it, by Health Cert and by the Skin Cancer College Australasia for either dermatoscopy or dermatopathology. Okay, so apart from these structured courses, the only way that GPs can learn this material is by private study and by accessing online things like DermNet New Zealand, by going to presentations by people like Alan Cameron and myself and Jeff Keir. But here now with HealthCert and with the Skin Cancer College Australasia, there are structured courses that people can do. The practical importance of these is that your ability to diagnose melanoma, for example, is been shown to improve by between 5 and 30% with dermatoscopy over naked eye examination. But that depends on the experience of the physician and the training. In other words, it's been shown that without training, dermatoscopy can actually cause a decreased performance because people think everything's interesting and different and they cut everything out. So training is essential. And because dermatoscopy is now standard of care in Australia, doctors treating pigmented skin malignancies are expected to use a dermatoscope. The training is just as important as the dermatoscope because without the training, things aren't going to work. Dermatopathology, there's a wide belief in the primary care population of doctors that dermatology is 100% like a litmus test. It tells you if something's malignant or benign. The diagnosis rendered by the pathologist is like, absolutely certain. But an understanding of the limitations of dermatopathology and the need for correlation with the clinical and dermatoscopic factors to get an accurate diagnosis is absolutely essential if patients are going to be managed safely. And that's what this course is aimed to deliver.